Hello and welcome to the Digital Health Technologies course, Module 1, Lesson 2, How Health Information Technology is Transforming Healthcare. The Digital Health Technologies course is developed by the Grow Behavioral Health Workforce Program of the Center for Health Innovation. Lesson Summary. This lesson provides an overview of the benefits and challenges to the use of digital tools in behavioral health care. It discusses the impact on organizations, providers, and patients. Students who successfully complete this lesson will be able to describe 3 benefits of digital technologies in behavioral health, describe 3 challenges to use of health information technology in behavioral health. Keywords to know include: there are 2 sections to this lesson. Section 1, Benefits of Health Information Technology in Behavioral Health Care, and Section 2, Challenges to Use of Health Information Technology in Behavioral Health Care. We'll conclude with the lesson summary, and as always, don't forget to check your understanding with the accompanying quiz. You may take the quiz as many times as needed, but you need to pass with a percentage of 80%. Section 1, Benefits of Health Information Technology in Behavioral Health Care. Using technology, information can be shared securely and quickly with the appropriate people. Technology puts in place processes for data collection, storage, and sharing. These processes are streamlined. No longer do organizations need huge file cabinets full of patient records. Instead, records are stored and backed up on secure servers. Definition time. A server is a computer designed to process requests and deliver data to another computer over the internet or a local network. Some more benefits of HIT in behavioral health care. Using technology, you can reach beyond any single healthcare organization. So when data are collected, when a patient visits several different organizations, technology can link all of the information about that patient together so the patient receives better care and there's better information about what works and what doesn't. Definition time again. Interoperability is the ability of any health information technology to allow appropriate health information to be exchanged with other systems. And I want to emphasize appropriate. Information is only exchanged with other organizations or individuals, which as permitted by the Privacy Act, HIPAA. This seamless exchange of information has many benefits. It increases the ease of care coordination. It improves communication between patients and healthcare team members. And most importantly, the people who need it have access to information when and where it is needed. So if your patient shows up at the emergency department with a broken arm, the provider there knows about your patient's other healthcare problems, whether they be medical, mental health, or other. Additional benefits. The Substance Abuse and Mental Health Services Agency, or SAMHSA, requires certified community behavioral health centers to use an HIT system to support health improvement activities, such as population health management, quality improvement, reduction of disparities, research, and outreach. So technologies not only have benefits for individual patients, but for organizations and for the communities they serve. HIT systems also support required reporting on data and quality measures, so they provide a way for us to really evaluate and understand whether what we're doing in healthcare is effective, how it works, and how well individual organizations are performing. Mental and behavioral health professionals are really important partners in the nationwide effort to use health information technology and create effective communication across the care continuum. At the beginning, mental health and behavioral health professionals were not included in the spectrum of health information technology. Most of the focus was on hospitals and primary care and urgent care providers, on medical care. But as the evolution of technology has continued in healthcare, the really important role that mental and behavioral health professionals play has become obvious, and the emphasis on integrating them into emerging technologies has become really powerful. Definition time. Workflow is the sequence of tasks performed within and between work environments. A workflow can be performed by one person, several people in one organization, or people at different organizations. In sum, here are the benefits of health information technology in behavioral health care. When used effectively, HIT systems can improve organizational workflows, improve communication with patients, improve communication between providers, provide links to support services, improve patient self-management, support evidence-based care, and provide data for quality improvement efforts. Here's one use case, an example. Health information technology and COVID-19. As we continue through the COVID-19 pandemic, health information technology has been essential and continues to be essential to keeping healthcare systems running during the pandemic. It has helped to keep providers safe. Healthcare workers have been able to conduct visits remotely via telehealth, track the spread of infectious disease and its impacts. Healthcare organizations have been able to contribute information to local, state, and federal government databases. It's helped gather information needed to develop vaccines and treatments, provide support for people who lost jobs or needed extra assistance through online resource databases, and allows providers to offer customized care that fits the patient's needs. However, there are some challenges to the use of health information technology, especially in the behavioral health setting. The first is cost. It is not cheap to invest in technologies or to train people in those technologies, so the costs can be prohibitive to get going. Although long-term, these technologies have been shown to produce cost savings, more efficient care, and less use of unnecessary care, and often even prevent exacerbations that can lead to very, very costly hospitalizations and emergency responses. The infrastructure is often not there. In rural and frontier communities, that infrastructure starts with lack of broadband access. So most of these systems do depend heavily on very fast internet speeds. And without that local physical infrastructure, it's difficult. And at the organizational level, the infrastructure simply to have dedicated servers or computer systems that can run the software was originally a challenge. At this point, most systems are cloud-based. So the important piece is the speed of the internet to be able to access cloud-based servers, and less so the individual organization's capacity for computer systems and servers. And there are even some technologies that are being developed, like a mobile app that can be used on cell phones by community health workers out in the field in very remote regions of the world, without having to be fully connected to the internet at all times. The uploads happen when people return to home base where they have internet access. Another challenge is the lack of a trained workforce, both in IT and healthcare. When healthcare started adopting IT, it was almost comical as people from completely different fields came together to try to create a system that would work. Too often the systems were clunky and did not address the workflows in healthcare, or they healthcare providers had no idea how to use the system. So the training of the workforce has been a critical and very difficult path, and it continues to be a challenge. Lack of common interoperability standards. There's that word interoperability again. With lots of different companies developing different health information technologies to collect patient data, for instance, different EMRs, there was no standard for how do you refer to a patient with type 2 diabetes. There wasn't any kind of standard diagnostic codes, so they started pulling those things in, or what age groups do you break into, or, how do you classify patient's ethnicity. It might be the same, but things might be in a different order. So without those standards, sometimes it's difficult for organizations to the standard nomenclatures and other standards in the way that the technology actually operates. It's hard for them to communicate with each other. That is improving, but it still remains a challenge. And finally, ethics and security. Once we start putting information into any kind of digital format that is located in the cloud, obviously there are huge ethical and security issues that arise. We will talk a little bit more about that in the next module as we're talking about cyber safety. Here's a use case that shows some of the challenges specifically to paraprofessionals. This study was of community health workers. And the study identified 3 important benefits for community health workers working in the field for the populations that they served. They found that when community health workers were given digital tools, their clients experienced improved access to and quality of services. There was an increased efficiency in training and personnel management, as community health workers were able to interact online and receive training online and deliver it as well. And finally, data that was generated across grassroots platforms was able to be leveraged for further research and evaluation. So those benefits that we talked about, they found were really concrete. However, there were challenges, as always, funding. As you know, community health worker programs tend to operate on soft money, so when the grant is over, the money goes away. And funding for the digital and IT programs was similarly often on soft money. The digital health literacy of community health workers, or the plain digital literacy of the CHWs, was low. Many of them were not able to navigate some basic computer skills. And they also experienced systemic challenges related to motivating CHWs, including adequate CHW supervision. So that was another challenge. Many CHWs maybe weren't motivated to learn in the online environment, to learn to use the tools. So here's a quick summary of what I've just discussed. Used effectively, health information technology systems can improve organizational workflows, improve communication with patients, improve communication between providers, help quickly link to support services, improve patient self-management, support evidence-based care, and provide data for quality improvement efforts. Challenges to the use of HIT include cost, lack of infrastructure, lack of a trained workforce, lack of common interoperability standards, and ethics and security. So let's pause for a moment to reflect on health tech. Again, you don't need to write anything and submit it for this. Simply pause to think. Think about your family's use of digital technologies. What are 3 benefits and 3 challenges that your family encounters with using digital tools? And those may differ depending on whether you've got a 2-year-old or a teenager at home, or you're single, or whether you've got multiple people all vying for the same television. So there's lots of different ways in which digital technologies are beneficial, but they can also be challenging, as we know. I'd just like you to think about how that impacts your daily life. The Digital Health Technologies course has been developed by the Grow Our Behavioral Health Workforce program of the Center for Health Innovation, with funding from the Health Resources and Services Administration.